And I'm going to be doing a demonstration on teaching and showing you how to properly brush and floss your child's teeth. I'm currently an EFTA, which means I'm an expanded functions dental assistant, which again just means that I actually went to school for dental assisting and got certification through my state association, which in my case is Missouri Dental Association. I'm also licensed through Missouri Dental Board, which again it just means I had more certification and more training just to get more paperwork for this, as I am a little bit fancy. I just want to thank you for watching today, and I hope you enjoy our demonstration. I'd like to introduce my assistant, Addison.
Hi.
So at my office, we are a family practice, so we see many children. We always recommend that parents assist with brushing, just because brushing with children can be really hard. One, sometimes kids don't really have their motor skills developed until they're a little bit older, usually about between ages 8 and 10. And then two, they also don't know the importance of hygiene until a little bit later. We do follow the ADA recommendation of brushing twice a day. So when you are doing it with children, we always recommend that you help at one point in the day. For me, I like to help my children with the our nighttime routine. It's a bit easier for me just because our morning's a little bit rushed. I have two daughters. Addison here is 8, and then I also have a 4-year-old daughter. I do help my 4-year-old a little bit more, usually about every single night, with the brushing and flossing because, like I said, she's not fully developed with her motor skills and stuff, and knowing how important it is to keep her teeth clean, that she thinks that just a quick once over will do the job good. Addison here is pretty self-sufficient, so she does most of it by herself. Every once in a while I'll give her a once over and check her about once a week. I try to assist her with flossing because they can hurt themselves. There's multiple ways to help your children brush their teeth. There's 2 ways that I like. The first way is standing in front of the mirror here. And this is great so older kids can kind of see how you're brushing their teeth. Another thing is that they can use a hand mirror so they can see up a little bit closer and see exactly how you're brushing their teeth and where you're going. Another way is for younger kiddos is to lay the child down in your lap, like so. And you would just lay them down like this and have them open. And it's easier to kind of brush them like this. This is also great for a team effort for your significant other or another family member to be able to help them out, maybe hold some arms and legs if needed, because we want them to know that brushing is important and it's also not really an option. So when you're brushing your child's teeth, I always recommend using a child-sized toothbrush. This is great because the head of the toothbrush is very small, so it can fit in between their cheek and their tooth without causing them any discomfort. And the bristles on the toothbrush are always very soft. This will help because kids like to kind of scrub away too much. This helps so that way they aren't really brushing or harming themselves by scrubbing too hard. Another recommendation is doing an electric toothbrush. This is great because you kind of cut out a lot of the toothbrush doing most of the work and not so much as the child. It kind of gives them a little extra cleaning. When you're brushing with the kids' teeth, I always recommend that you use a pea-sized amount of toothpaste, and this also goes for an adult as well. So I always recommend about that much. A little goes a long way. You don't need much. For a child, you can always do a little bit less. Fluoridated toothpaste is the best when they are able to spit and not swallow the toothpaste. So before that, any toddler or baby toothpaste is good. If they know how to spit without swallowing on their toothpaste, then I always recommend going to a fluoridated toothpaste. It doesn't matter the flavor, just whatever works best, and whatever usually has an ADA recommended seal on it is what's really good. So for my kids, I always try to brush the 4 quadrants of the teeth. That'd be here, 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 for about 20 to 30 seconds each when I'm brushing the outside, the inside, and all the way on the top where the chewing surface is. Now this is where it gets tricky with the children. You want to brush all the way back here so you're getting that very back side of the teeth like this. You can spit. So normally you do obviously all 4 quadrants, but for the sake of this demonstration we'll just do that. The next thing after brushing it is then we would move on to the tongue. And for my kids, I usually just kind of do the tip of the tongue because 2 reasons. One, I don't want to gag them and they think it tickles, so I usually just do about that a few times. That's it. That usually gets off any bacteria or debris left on the tongue, and that's about it. The last thing one of the last things to do is flossing. I always recommend getting a glided floss. It's a lot more comfortable. I don't ever recommend floss picks because they don't do the job well because they're usually too stiff. They're good for on the go if you have them thrown in your purse or in your car for getting something out after like a steak night or something. But as far as doing them on yourself or your children, they can kind of cause a little bit harm and they don't do the job properly. When you're flossing the child's teeth, it's always good to do the same thing. You can do it from the back like this and just bringing the floss down between the teeth. I'll show you with a little bit closer model here. You're going to take the floss down in between the teeth and you'll create a C shape with your floss. So that means hugging it on both sides of the tooth like this, or hugging it on the opposite side then afterwards. And you'll do that between every single tooth as well on the very back of the teeth. And then the final step of taking care of your child's teeth is using a mouth rinse. We always get a child mouth rinse because it has a pre-made measuring cup and it usually will not allow the kid or your child to do more than what is supposed to be done in the rinse. So most children's rinses are fluoridated, and this is great if you're not ready for that for your kid because they don't know how to spit yet. You can always practice with just water and a little bit of the toothpaste and make it kind of a toothpaste flavored rinse. And just practice with the spitting because you don't want them to swallow this. The rinses, you want them to rinse between 10 to 30 seconds depending on what the manufacturer recommendation is on the back, but I always say 10 to 30 seconds is great depending on their age range as well. Addison's here is 8, so she does the full 30 seconds. So I'll let you show you what she does. You don't have to do the whole thing, kind of just swish and spit. And that's it for her. So that's our whole demonstration for on how to keep your mouth healthy. And this is very simple and effective. Sometimes it can seem like it's a lot, but I think these are great steps to taking important steps to making sure your child knows how important your oral health is. So I appreciate you watching today, and thank you.